in 2011, I fell down the stairs at home, picking up a cat, and I managed to break my tibia and fibula and crush my ankle. And so from that day on, I was in hospital for 26 nights, having an Ilizarov frame fitted to it. I was treated in that hospital, by that hospital, for 3 years, but I was fortunately able to get a referral to a limb reconstruction clinic, which is where I first saw the IMPARTS programme and the effect it can have. On my first consultation at the clinic, I was given an iPad and asked to complete the questionnaire. And the questionnaire is a page of about 5 questions with usually a 1 to 10 answer. Based on the answers you give to the first page, there will then be another 5 questions. And it builds up to a picture of your life. It's not so much about your injury, it is about your pain levels and how often your pain happens and how bad it is. But it's about your state of mind. And it's very unusual, really, when dealing with orthopaedic injuries, that anybody asks you how you are. But the IMPARTS assessment definitely does ask you how you are. Well, it was quite clear after 3 years that I wasn't the person that I had been 3 years before. And but that was something that was very, very difficult to want to explain to anybody. I was pretty guarded the first time I did the questionnaire, to the extent that the consultant looked at my answers and asked me if I would do it again and be a little bit more truthful this time. So I think it rather rumbles you if you're not giving the truthful answers. It didn't feel in any way that it was a personal thing, because of course the questions weren't being asked by a person, and I was given the iPad to complete while I was waiting in the waiting room. So in fact it was a good opportunity to do something while I was waiting, and I was a little apprehensive about my appointment. But I think it's become a very safe and easy way for me to bring to the attention of the team who look after me any kind of issues that might have changed without me having to make a bit of a deal over it. Fortunately, they agreed to take on my care, and it did mean that I spent quite a number of appointments with a cognitive behaviour therapist who was very helpful. I want to say she was supportive. She of course was supportive, but she was very useful as well to me. I also had a psychiatric review, and not surprisingly, I was found to be depressed. I think that that's made a big part of my recovery, that I've actually been considered as a whole person, and I've been considered as Fiona instead of bed 3 or wherever I was before. So yeah, the whole team worked together using the IMPARTS programme, and it's very comforting to know that they know how I'm feeling. It took into consideration my life as it had been, and it took into consideration the life that I was living at that time. It also gave me something to look forward to, because I knew that I was going to improve with the treatment that came with the IMPARTS programme. So yes, it was very important. For me, it's been an enormous, enormous part of my recovery. I don't like to think about the person that I was 3 years ago, who was shut down emotionally and disabled, and all I felt like was a person with an injury.